My name is Sean Pieri, Pierisean, Vice President for Development and Marketing, Driscoll Children's Hospital.
And who are you with?
I'm Craig Smith. I'm the President and CEO of the Driscoll Health Plan.
And we're here today to talk about a recent decision. There's a process going on right now with Texas Health and Human Services Commission, and they're going to change the procurement. There's some procurement changes happening to Medicaid and CHIP that really adversely affects Driscoll. Can you tell us what's happening?
Well, the procurement process is typically a process that HHSC has to regularly go through. Unfortunately, the basis of that procurement process, essentially their methodology and scoring, we feel lacks consideration of really the value that health plans have brought to the communities for not just a decade, but up to 2 decades, 20 years that some of the health plans have been operating in service areas. And unfortunately, we feel like this procurement failed to achieve recognition of the true value that the state has built over that time. The real problem with that is the procurement as it is currently intended essentially abandons the investment of over 20 years really for a numbers game on a procurement that again, we feel unfortunately lacks input by the most important stakeholders to the Medicaid system, the members, the providers, the local community. None of that was considered in this procurement. And for that reason, we feel like this procurement is essentially fatally flawed.
What will the impact be for South Texas?
Well, it's a tremendous impact for South Texas because of the disruption that would be caused, not just the Driscoll Health Plan, but another health plan that will be removed. 75% of the children in South Texas would have to effectively change their health plans, which could also potentially require them to change their providers as well, depending on the networks of the health plans involved.
And the general public doesn't know much about this yet.
They don't. At this point, it's an intended award, and so that's why there aren't a lot of details out on the procurement right now. Unfortunately, on a day like this, a monumental day for South Texas, where it's seeing an expansion of services for children, and unlike anything before, that this crisis is looming on the horizon. But we are heartened that our legislative delegation has already taken the mantle to defend these communities, to stand up for Driscoll in doing so, and to really kind of set the expectation that the agency and that our state really create an additive model to healthcare instead of one that simply rips out investment and tries to replace it. One that builds on what we've done for the past 2 decades.
It should be noted that there's a process to appeal this decision, and we've gone through that process. We're in the middle of that right now. We've got the legislators all throughout South Texas helping us with that, and we're in the process of hopefully overturning this outcome.
How big a surprise was it for you both?
It was a tremendous surprise. So this is actually the third procurement to attempt to recontract this business. The first 2 procurements we won handedly. Unfortunately, with other issues in those earlier procurements, the state had really we would say overcorrected to try to avoid faults of the past, and in doing so created a whole new set of issues and problems, and one that we certainly did not expect this result. The Driscoll Health Plan is very proud to say we're one of the top performing health plans in this state. We have been so for years and years serving this community, and so for us to be cast out, it really is a shock.
Did I read that Driscoll Health Plan, that's your only contracts, and so without that plan, you effectively are out of business?
We have a Start Kids contract as well, but unfortunately the Start Kids contract, it serves a smaller population, a much more acute population, and essentially the risk of doing so is much more volatile. It's hard to run a business on just Start Kids. Unfortunately, in the past, there was an instance where another health plan tried to do so, not in South Texas, and wasn't able to sustain it financially. We do have that business, and we intend to serve those children as well as we do today. But this does create concern about whether or not the sustainability of providing health insurance across all of our populations when this is significantly the largest piece of our population. If we're roughly 195,000 members today, what we could be losing could be 185,000 of that.
It should be noted that the care that happens at Driscoll Children's Hospital is safe and protected from this decision. Driscoll's fortunate to be in a very strong financial position, and so we will continue to provide that care that's needed for the children of all of South Texas. And our new hospital in the Valley is a perfect shining example of that.
You mentioned the legislators of South Texas.
Yes, sir.
Are with you, both sides of the aisle, Republican and Democrat
Yes, sir.
alike, led by Senator Hinojosa, was acknowledged today by Eric Hammond. And today, of course, we had the Lieutenant Governor here, Dan Patrick. Have you had a chance to talk to him? Do you know where he stands on this issue?
Neither Craig nor I have personally talked to the Lieutenant Governor, but those conversations are likely happening.
Is there anything I've missed? Anything else you'd like to add on this particular topic?
I think it's an unintended consequence that Driscoll, along with Cook's Children's and Texas Children's, are being eliminated from the health plan business through this change in direction and policy. And realistically, we just want an open marketplace. We want to be able to compete. We have 53% of the children in South Texas are insured through the Driscoll Health Plan that qualify for this program. 70+% are in Nueces. About 40% or so are here in Hidalgo service area. We just want to compete and not let the legislators or the bureaucracy of the process get in the way of that. We think if we're given that opportunity, and that's what we're asking folks to help us with, we're going to be just fine.
Anything else, Craig?
No, that was good.
Sean, Craig, thank you so much.
Hey, Mom.
Thank you so much.
Thank you,
for today's
appreciate it.
interview.